Public health and religious freedom collide in New York State. Facing a continued measles outbreak, the state will no longer let parents opt out of vaccinations for their kids over religious beliefs. As Fox's Karina Capabianchi tells us, the state's governor believes the risk to public health is a greater concern.
Opponents of ending religious exemptions for vaccines rallied outside the Assembly chamber, saying it's a civil liberty issue.
All these parents here today believe that it's a parent's right to choose or refuse vaccines for their own children based on faith.
As of Wednesday, the New York Department of Health says there are 336 confirmed cases of measles in the state outside of the city. Senator David Carlucci, who co-sponsors the bill to end the religious exemptions, says it's time to reverse the trend.
That's something that I think is often forgotten, is that people say, well, I'm healthy, it's my choice, I can do what I want to do. The reality is that why we ask you to get vaccinated is not necessarily just for yourself, it's to protect those that can't get vaccinated.
The governor has called the issue a public health crisis.
I understand freedom of religion. We all do. We respect it. I've heard the anti-vaxxers theory, but I believe both are overwhelmed by the public health risk.
A recent Siena College poll of 812 registered New York voters showed 84% of those polled supported vaccination requirements for children regardless of their parents' religious beliefs.
If you ask the voters, this is a no-brainer. Absolutely. It's got support from 85% of Democrats, 88% of independents, and 79% of Republicans. Across the board support.
According to the CDC, the majority of measles cases in the country are in the state of New York. At the state capitol, Karina Capabianca.
Still looking for the perfect Father's Day gift for your dad? Well, how about plastic surgery? According to the American Society of Plastic Surgeons, more than 1 million men had some form of cosmetic procedure last year. Now, that's an increase of almost 30% from 2000. The most popular procedures were rhinoplasty, eyelid surgery, and liposuction. Nearly 500,000 men had a Botox procedure last year, and more than 100,000 had filler injections.